Welcome back, my Be Health Empowered family, to another week of Excuse Me, Doctor. My name is Dr. Melissa Clark. Of course, please call me Dr. Mel. I am delighted to be back here with y'all at the top of the week, getting ready to kick off this amazing week with all the health, everything that we have for you. And, we are here each and every week specifically for you to make sure that you have all the information and all the facts that you need to make wise health decisions, not just for yourself, but also for your family and for your community. If you are joining us for the first time, our newbies on the block, welcome, a special welcome to you. And, I really hope that you hit that like button if you're checking us out on Facebook, and that subscribe button, that red button, if you are checking us out on YouTube. Now, of course, like I said, we're here for you. So that means we want you to participate. Throw those questions that you have as we go along, throw them in the chat. Throw up your comments, anything you want us to make sure that we highlight about our topic and all the stuff that we're going to cover tonight. So, with that being said, those of you who are my BHE family and you're the veterans, you know that I cannot do this by myself. I have to have my two fantastic co-hosts, Mr. Wayne Bruce, Miss Lila Mays. Come on out of the shadows.
Come out of the shadows.
Come on out of the shadows and join me on camera. How y'all doing?
Hide.
Happy Monday.
Happy Monday to y'all.
Happy Monday.
How you doing? Good.
Doing good. We're all looking good in this orange. I was
just gonna say that, Dr. Mel. I love that orange you have on.
Well, thank you. Orange is my favorite color, but all of us are repping tonight because this is a color for Multiple Sclerosis Awareness Month, also known as MS, which happens every March.
Right. And I think a lot of people have heard of MS and may even know someone with it. But honestly, who can really explain what it is?
Well, for real, I'm not raising my hand because other than knowing what MS stands for, I really don't know much about it.
Yeah, that's interesting. And again, like I said, a lot of us have heard of it. But I don't think we've ever really thought about how common it is with Black people. I actually have a colleague and friend who was diagnosed, and it took a long time for her to get that diagnosis, all the while her body seemed to be changing overnight.
Yeah, and here's the thing, what a lot of people don't know about multiple sclerosis, or MS, we're just going to call it MS, is it's actually hitting Black women harder than we realized. So not only do Black women get diagnosed more, but sometimes the symptoms are worse in Black people and in Black women specifically.
So facts. So today we're getting the real deal from a medical expert. What is MS? Why is it hitting Black women so hard? And most importantly, how can you fight for care if you're a family member, or if you if you're stricken with MS and it shows up in your life, how can you fight the disease and get the care you deserve or your family member deserves?
Exactly. So we'll discuss all the things. And as y'all know, you know how we do. We're going to ask the questions you want to ask. And if we haven't asked those questions, please be sure to drop your questions in the chat.
Yeah, in the comment section of whatever platform you're looking at.
Yeah, it's going to be a great show. I hope everybody is sharing this episode right now as we speak. We are live. So share it. You got time to get it out to your network, to people that you know who have MS or living with MS, or just have questions. So share.
Our MS warriors, and share if for no other reason is this is my first time in 200 years wearing an orange shirt. For no other reason of that.
Catch this blue moon event or orange moon event tonight.
I look kind of good in it though, kind of tone up. You got to match the tone. Anyway,
it brings out your underlying, coloration. So
Coloration.
your
Is that like
coloration.
hateration? That's not like hateration, though.
Not in
But
this dance.
okay,
thing,
let's
no.
move on. Let's go to the week in health and wellness. That was the recap. So, Dr. Mel, I read the recap, and it says diets and colon cancer risk. And I mean, every time I think about colon cancer, I think about my man, the late Chadwick Boseman, Wakanda Forever, and I'm on a diet. I have a personal trainer trying to lose weight. And,
Right.
A lot of friends of mine are on diets. And this cancer risk has something to do with low carb diets.
That's right. Well, first of all, we know that colon cancer has been on the rise, especially in the younger age groups. 30 to 34-year-olds, 70% increase in colon cancer rates. 35 to 39 age group, over a 50% increase in colon cancer rates. So we know it's on the rise, and some very preliminary research is showing that it may be linked to low carb diets.
Wow. That's incredible. That's incredible. Yeah. I'm not on a low carb diet though, Dr. Mel.
Well, that's good. That's good. And just for people who might not know, low carb are things like the keto diet or the South Beach diet, where you have few to no carbs, but you do
eat
a lot
of fat and proteins, right?
Exactly. Yes. And so we know that the bacteria that live in our gut can increase our risk of cancer. And so what we eat is what determines the bacteria that live in our gut. So whether we're eating protein, fat, veggies, pasta, fruit, bread, whatever, that determines the bacteria that live in our guts. And so recently, scientists decided to test this theory on mice, right? So this is not a human study, this is mice. So they tested different diet combinations. They found that a low carb, low fiber diet combined with a specific strain of bacteria, the famous E. coli, so a particular strain of E. coli, caused DNA damage, higher rates of DNA damage, higher rates of precancer tumors that we call polyps, and premature aging of cells in the gut. But I want to call attention to the fact that it was low fiber diet. So it might not have been the low carb, it might have been the low fiber diets. But a lot of times fiber is associated with eating carbs. So our fruit that we have, especially our veggies, are where we get most of our fiber from.
So where can we find fiber? Is it like Metamucil or FiberCon or, the whole thing?
Yes. So those are ones that you can buy at the drugstore, but the best sources of fiber are the ones that are in your diet, and the ones that they found when they added it back into the diet of these mice, they found that it was actually protective, was the kind of fiber that comes from food, especially grains, fruits, and vegetables.
Okay. So like we always say, we should be eating the rainbow of foods.
Of foods, right? Not Skittles, right?
Not Skittles. Don't mistake it. I know it's somebody out there that'll be like, we should be eating the rainbow. Give me that pack of Skittles. We're not talking about Skittles.
We mean all the different colors, colored fruits and vegetables and everything that's out there.
That would be me. I used to give me the Skittles. Anything with sugar in it. So
I am so happy you've turned over a new leaf. Look at Wayne Bruce. Yes, it is.
But I need to turn over a whole new tree, not just a leaf.
Garden.
I got some ways to go. I need to turn over a whole tree.
All right, moving on to number 2, wine. Red over white lowers cancer risk. So talk to us about that, Dr. Mel.
Right. So I just want to level set. We've done shows on this. We've had recaps on this. Drinking alcohol does increase the risk of cancer, and alcohol definitely includes, unfortunately, wine.
Okay, but so many of us have heard that red wine is a healthier option because it has more antioxidants than white wine, right? So my friends in the wine club should be good with their Merlots and their Cabs, right?
Well, according to recent research, that would be a no, because researchers reviewed over 47 studies and found there was no significant difference in cancer risk between red wine and white wine overall. They equally increased cancer risk.
Mhm.
Um,
Wow.
white, they did find one instance where white wine was worse than red wine, and that was specifically the risk of skin cancer in
Mm.
women. But the bottom line is there are no safe alcoholic beverages in terms of cancer prevention. They all pretty much, unfortunately, put you at higher risk.
Sorry,
Yeah.
sorry to my friends in the wine clubs.
Yeah. Sorry to
All right, all right. Our last item on the recap is your heart going to pot? What does that mean, Dr. Bill? What are we talking about here?
um is your heart going to pot? Well,
Mhm.
there have been several studies that are showing a link between daily cannabis use and heart disease. So
Mm.
that's not the occasional blue moon users of cannabis. These are daily users. So in the Journal of the American Heart Association, there was a study that showed a 25% increased risk of heart attack and a 42% increased risk of stroke compared to non-users. And there was another study that showed a 34% increased risk of heart failure. So that's heart attacks, heart failure, and strokes, all higher in daily cannabis users.
Wow. Why is that, Dr. Mel? Because most people think that, smoking some weed pieces you out. So
Mhm.
why wouldn't that be good for your heart?
Well, it turns out that cannabis contains chemicals that can cause an immediate rise in blood pressure and heart
Oh,
rate that could strain the circulatory system. So you might have heard of people smoking weed and actually having palpitations and feeling like their heart is racing. So that
yep.
those are the initial effects. And then the active compound in a component of cannabis, THC, has been shown to cause inflammation in the lining of our blood vessels, which can ultimately lead to blockages in the blood vessels, which is how it then could cause a heart attack and a stroke.
Mm. Wow.
Okay, so that's mainly for people who smoke weed, right?
Right.
Everybody knows smoking isn't good for you.
That is correct. When you smoke weed, that does contribute in addition to damaging the lungs and the heart system by introducing the chemicals that are in the smoke. But the research actually suggests that just cannabis use, daily cannabis use, whether you're smoking it, you're vaping it, you're consuming it as edibles, all those do have this higher risk of heart attack and stroke.
I don't know about this show. This no wine, no. No, I'm
Well,
just
I think it didn't say use in moderation is not a, it's the daily use that
okay.
The-
is that they studied in this study.
All right.
uh
And I'm not advocating using it
I know.
infrequently. I'm
I
just
know.
saying
See, she didn't advocate and she froze.
Too
Is
fro-
what happens when you touching the advocator button on the computer. It happens all the time. I'm sorry you froze Dr. Bell.
Oh, she'll
She
come back.
but she looks cool in this orange. Hopefully she comes back. But it is the daily
It's
use.
daily. This is really interesting. This
Right,
is actually
because
really, really interesting.
we
Yeah,
think
because
we
people
think
are
it's we think it's just, it's from the earth but it's daily use
right.
that's giving you that.
All of those things, right? It's from the earth. It's
It's not
chilling me out.
tobacco. It's
Right. All of that.
it's not
Um,
tobacco. It's all the things we think that may or may not happen in this thing. And there's Dr.
there's
Mel
Dr.
back for the daily use.
you're right. So what else we have going on? I know that was a not exciting recap for some people. Maybe
Mhm.
I'm sure.
exciting, but
So we had to go to the
Weekly debunk. Stopping misinformation in its tracks.
All right, so Betty Bama says, I was watching TikTok the other day, and for real, I think I have ADHD. I daydream and procrastinate a lot.
I don't know about that. Excuse me, Dr. Mel. Is that true?
Well, I don't know whether she has ADHD. And the thing is, a lot of people are diagnosing themselves with ADHD based upon what they're seeing on social media. There have been just a slew of videos and misinformation on TikTok that sort of romanticize attention deficit hyperactivity disorder, which is ADHD, and present misleading information about its symptoms.
Okay. Well, I think, because I've diagnosed myself.
What y'all think?
What y'all think? Have you folks in our comments, like me, diagnosed yourself with ADHD based on what you've seen on social media, TikTok? For sure.
You know, everybody has.
Right.
I mean,
right.
If you watch one of those videos every 10 minutes, don't watch one, because then 13 others will come up that says, you have ADHD untreated. It's gone on all your life. Because remember that exam in 3rd grade where you weren't paying attention? That was the first sign.
Right. There was actually a study, while folks are weighing in on that, there was a study done by University of British Columbia that analyzed the 100 most popular ADHD themed videos on TikTok, discovered that fewer than half actually reflected the true medical definition of ADHD and had, the real ADHD guidelines for treatment. So
interesting.
I don't know what folks are saying out there in the chat, but just something to keep in mind.
We can go to the chat right now. Antonia Mack says, no, I've gotten an official diagnosis.
Oh, okay.
Okay, Antonia.
All right. Well,
and
we're glad.
Because Yvonne Smith says, no, I actually have that diagnosis.
Wow.
Gave to me as an adult. Wow.
Got it. Well, I think it's always best to get it from a practitioner that knows what they're talking about and can specifically go back and forth with you and your particular, health profile and health conditions so that they can help you work on a treatment plan. Right.
Yep.
So that's the advantage of not self-diagnosing on TikTok. So
for sure.
Yeah. TikTok doctors to the rescue.
There you go. Well, thank you all. We're going to see you back in just a little bit. We are going to launch into our topic for tonight. We're talking about a disease that you may have heard of, but one that you might not know its effect, the true extent of the effect in communities of color, especially the Black community. It's called multiple sclerosis, or MS. And we're going to find out tonight what it is, why some people are at higher risk, and what you can do if you or someone you love is affected by multiple sclerosis. And to really make sure that we understand this topic inside and out, we have an incredible guest who's going to help us walk through this. Dr. Mosunmola Oyawusi. She's a neurologist and assistant professor at Howard University Hospital in Washington, D.C. She speaks nationally about diseases of the brain and nervous system, including multiple sclerosis. Welcome, Oyawusi. Thanks for being here.
Thank you, Dr. Mel, for this opportunity.
Absolutely. Well, let's jump right in. What is multiple sclerosis, or MS, and what is actually happening inside your body if you have this diagnosis?
Yes, well, multiple sclerosis is an autoimmune disorder. There's different presentations of multiple sclerosis, but what happens is that the person's immune system fights against normal central nervous tissues. So that's the brain and spinal cord. And these antibodies against more specifically myelin, which is a protective covering of the neurons and nerves, causes dysfunction in those nerves. And that will result in different clinical presentations. Someone can have cognitive impairment, they can have changes in their behavior, depression, they can have motor and sensory dysfunction as well.
What
So
does that mean? What is motor and sensory dysfunction? Can
okay,
you break that down? Uh-huh.
surely, yeah, with motor dysfunction, one can have weakness, or they can have problems with the coordination of their movements, especially if the sclerotic plaques occur in the parts of the brain that manage coordination, like the cerebellum. One can have pain. They can have pins and needles. That's a very common symptom of multiple sclerosis. Pins and needles, or constant pain or numbness. It all depends on where in the brain they're having these plaques occur. And then there's other factors that we're still learning about, because there's different subtypes of multiple sclerosis, and of course that will dictate their overall presentation.
Right. So just to be clear, you mentioned that this is a problem of the immune system. So we all know the immune system is supposed to be protecting us from
Mhm.
bacteria, from cleaning up. It cleans up cancer cells when they pop up in our bodies. It does all these things to protect us. So why is it attacking our nerves? And you mentioned the word plaques, sort of eating away at the protective covering at the nerve of the nerves to cause these little erosions in that, which are the plaques. What's happening?
Okay, so there's different factors that we've come to know over the years as we're understanding multiple sclerosis. There are genetic factors. It could be exposure to certain viruses, namely EBV, Epstein's-Barr virus, which is associated with mononucleosis. That's a common viral exposure that persons with multiple sclerosis have been found to have been exposed to set off this immune response. And then there's also environmental factors like vitamin D deficiency, low sunlight, that can play into, for whatever reason, why their immune system affects those particular parts of the nervous system, that protective covering, the myelin, which allows for this electrical signals to move along the nerves quickly and efficiently. And so
Mhm.
when you have that degradation, it results in plaques that kind of, I don't want to say gunk up, but affect the transmission of that electrical signal, and ergo, unfortunately, dysfunction.
Right. Sort of like a extension cord or something. It has a covering around it, in
Mhm.
order to make the electricity flow through it more easily. It's the same way in our nervous system. So, um, there's a lot of there's not a lot of publicity about multiple sclerosis in the Black community. How common is it really? I mean, is it a thing?
Oh, yes. And again, I appreciate you for bringing this to light, that there's actually increased incidence of multiple sclerosis in our community. Um, you know, Years ago, we would just think that multiple sclerosis was a disorder that affects white people. And yes, even though there is a high prevalence, meaning a high number of persons in the white community that have MS, we're seeing a growing incidence, like new cases of multiple sclerosis in people of color. And unfortunately, we're also noting that there are more severe cases in those communities, in people of color. Yes.
Yeah. I can just say, outside of being a doctor, anecdotally, I know personally 6 Black women with MS, 5 of whom unfortunately passed away as a result of the disease, one of whom was my line sister in Delta Sigma Theta, so this is very personal. And only one of these people that I knew was not a woman. Everyone else was a woman. So what's going on with Black women in multiple sclerosis? Why are we seeing higher rates in women in general, and then in Black women?
Okay, so there might be a hormonal factor why MS affects women more so than men, and inflammation is key to this immunologic response. And we're even seeing papers tying inflammation to stress, like emotional stress. So that possibly could be a factor as to why women of color are getting a higher incidence. And I found interesting what you were speaking about earlier regarding inflammation and colon cancer. Unfortunately, inflammation is at the seat of many disease processes. And if we can decrease those factors by our diet, exercising to decrease inflammation, decreasing our stress, hopefully that could optimize livelihood and decrease, the incidence of this disorder.
Right. We often talk about the fact that, the saying black don't crack, but unfortunately that's just for the outside. The stressors that we do go through as Black people can cause these higher rates, as you mentioned, of inflammation in our body and then leading to diseases like MS. Um, are there specific risk factors that make Black people or Black women especially more vulnerable outside of stress? Could it be environmental? Could it be genetic? Are there other things going on?
Yes, aside from the stress, also vitamin D, as I mentioned earlier, because our melanin, which is protective against sunlight, but it also decreases our ability to absorb vitamin D. And there have been studies that showed persons who had decreased vitamin D where it was associated with the type of work that they did. There was a famous study looking at nurses who they had like shift work and they had low exposure to to the sunlight, and they had low vitamin D, and there was an increased prevalence of multiple sclerosis in those persons. So being of color, that decreases our ability to absorb vitamin D. That is a big factor. And then there are some genes that are associated with it. I can't necessarily say that like some other disorders, maybe like sickle cell anemia, where you can see a specific Mendelian genetic
Like a
distribution.
specific one-to-one, yeah.
Exactly. But you can see it's familial. So if one person
Mm.
has a family member that has MS, there's an increased likelihood that another family member would. If they had a twin, especially a monozygotic twin, there's an increased risk that the twin could possibly also develop multiple sclerosis.
Right. So the identical twins versus fraternal twins are more likely to get it. Wow. So is this what age group are we talking about where, MS usually shows up? Like this isn't really a disease of children, right? Like what age do we typically see MS showing up?
You're right. So it's usually in the early 20s to 50s. And actually, there are some few cases, it's rare, that they might appear even slightly younger than 20s, but it's usually going to be like like a young adult if
Mhm.
it's younger than 20 and older than 50. We've seen some celebrities that they've been bold and they shared their story of their diagnoses outside of the age of 50. With
Oh,
those extremes, there might be a parallel in terms of the severity of their disorder.
mm,
Especially with older persons, they tend to have the more severe subtypes, more progressive,
okay.
unfortunately. Yeah.
And can you speak a little bit about the subtypes? So it's not it can show up in different ways, in other words. So can you maybe go through what some of those ways are?
Surely. So the most common subtype is relapsing remitting, meaning they have symptoms that are associated with neurologic deficit, and then they improve. So they'll have like an episode, a flare, if you will, and then it spontaneously improves. That the immune response possibly decreases, and then they reset what their baseline is, and then they pop up again, and it could vary. It's not as though that each flare will have a specific symptom. It's just an increase of neurologic deficits. A common heralding sign is what we call optic neuritis, where
Mhm.
there is inflammation to the optic nerve, and that will result in blurred vision, decreased vision, even blindness, along
Wow.
with eye pain. Yeah.
Mhm. Okay. So there's the relapsing, remitting, and then are there other types?
Oh, yeah, and then, and thankfully, with relapsing remitting, the prognosis is a lot, better compared to the other types, and that tends to be the most common. 85% of persons diagnosed with multiple sclerosis will have relapsing remitting, and then you have the progressive types, secondary progressive, primary progressive. Basically, they slowly progress in the deficits as time goes on.
Right. So it's not like it's not like
A
flares. It's
reset,
more like it
yeah,
just keeps getting worse and
slowly,
worse.
unfortunately.
Yes, got it. Um, can multiple sclerosis be cured?
Unfortunately, no. But what I will say that thankfully we've had great advancements in the medications available for the treatment.
Mhm.
And so overall, the livelihood of those diagnosed with multiple sclerosis have improved.
Wonderful.
There isn't a cure, but there
Mhm.
are more medications for available for the maintenance of multiple sclerosis, and there are more drugs that are available to cover the more progressive types. There was a time that we didn't have any medications at all for the progressive
Mhm.
types, and all we could do is provide medical support
Wow.
of the complications and symptoms. But thankfully, at least we have a medication called ocrelizumab, which is
Mhm.
not only indicated for relapsing remitting, it could also be utilized for progressive, and it's an infusion that one has twice a year,
Oh,
and it
okay.
greatly, yeah, it
Yeah.
greatly calms down that immune response and progression of inflammation.
Okay, got it. Now, I know Lila mentioned in the introduction to the show, that she had a friend and it seemed like it took a long time to come up with the diagnosis of multiple sclerosis. Is that a common problem that it's difficult to diagnose?
Unfortunately, yes. One, because people present differently, and then
Mhm.
there's also the incorrect thought that only persons who are white will have multiple sclerosis. So
Oh.
you might have a person of color present with symptoms, and if someone else, presented similarly, they might readily consider multiple sclerosis a differential diagnosis. So that's
Mhm.
part of the problem. And again, this is why I do appreciate all those who are advancing the education of not only healthcare practitioners, but the general community, so that
Mhm.
they can consider, hey, these symptoms that they're experiencing, maybe it's multiple sclerosis. Maybe I need to talk to my primary care doctor or seek out
Mhm.
advice from a neurologist or a neuroimmunologist.
Yeah. So how do you think what is the best way of if you think you have MS, but you go to a doctor and you're not really getting an answer, what's a way to advocate for yourself? What's a next step to take?
Including many people in the conversation is helpful, especially if you have a trusted family member or a healthcare supporter or buddy,
Mhm.
that will go along with you to add to your advocacy. But you're your biggest advocate. Um, Educating yourself with the varied presentations, and if your first discussion is not fruitful, seek a second opinion.
Mhm. So just be persistent. Yeah.
Yes,
And don't give up. I think that's
yes,
the key because a lot of times people might want to give up, you know, or they might be told by a doctor, try this and come back and see me. And they just don't go back because they didn't like the doctor, didn't trust the doctor. So just being persistent, I think,
yes.
is what I'm hearing. Um, and we know access to healthcare is a challenge. Are there specific treatments? You mentioned that twice a year infusion. That's a standard treatment. Is that a challenge uh, for Black patients or patients who have poor healthcare access to get to get access to? And what are things that people should be doing to make sure that they're getting the most up to date treatments?
Yes. So, thank you for highlighting that. More specifically with ocrelizumab, it's a very expensive medication. And actually, most of the drugs available for maintenance of MS can be a bit expensive. So it's helpful to get connected with MS foundations and organizations. They help with getting access to medication and financing your treatment. But then also, in terms of access, actually being an advocate and working with your insurance company. There's team members within the insurance company that could assist with the financing of your pharmacotherapy as well.
Mm-hmm. Right. So like case managers that a lot of people don't
Mhm.
realize insurance companies have case managers that when you have a complicated diagnosis and you require expensive medications, those case managers can help to make sure that you get the treatment that you need. So, if you have insurance, if you're fortunate enough to have insurance, that's definitely a resource. And then what about people who don't have insurance? Can multiple sclerosis, getting that diagnosis and becoming disabled, help you to gain access to either Medicaid or Medicare?
Okay, so definitely that diagnosis helps with getting access to Medicare at an earlier age. I would say
Mhm.
that. But being uninsured would be a great challenge in terms of the maintenance of the syndrome. So definitely getting a case manager to assist with getting insurance and
Mhm.
even getting multiple means of insurance, Medicaid, Medicare would be beneficial.
Got it. Okay. And then how important is it to have a neurologist versus a MS specialist? Um, you know, eh, does it make a difference? Is this something that your primary care doctor can manage?
I would say it helps to have more people in your team. Your primary care doctor aware of all the symptoms that could come about as a complication of multiple sclerosis and being able to connect you to other specialists. Sometimes a urologist might be helpful with the bowel and I'm sorry, the bladder complications that can occur with MS, GI with the bowel complications, a psychiatrist, psychologist, neurologist, and an MS specialist, along
Mhm.
with your physical therapist, occupational therapist, your social worker or case manager.
Mhm.
It's a full team that's required for the maintenance of this disorder.
Great. Thank you for bringing that out, that it really takes a team because our
Mhm.
nerves go everywhere in our body, right? And
Yeah,
so anywhere our nerves go, you can have problems. And so you might need a specialist for that particular area. And then the occupational and physical therapist to help, keep you functioning as long as possible. So
yes,
I
the
think
optimal.
that's yep. Great advice. And before we bring Wayne and Lila back with the questions from the audience, which I'm sure they're out there, what questions should somebody be asking their doctor if they're diagnosed with MS?
Okay. Well, what type of MS do they have? What subtype do they have?
Hmm.
Firstly, because then that is a great factor in regards to what medications are available to them and
Hmm.
how we as healthcare practitioners can support them in terms of their medications, connections to other specialists, as I mentioned, other team members that can help maintain their symptoms, what foundations might help them with financing their medications or access to diagnostic procedures that will help in the surveillance because MRIs are important. The neuroimaging, looking at the plaques that develop in the brain and spinal cord, are helpful in surveying how someone progresses. And they're
Hmm.
also expensive. You know, the medications are one thing, but the surveillance and other treatments can be a bit expensive as well.
Got it. Well, thank you. This has been great. I have a bunch of other questions, but I want to make sure that we get the audience questions in there. So,
Mhm.
Lila and Wayne, come on back, join us. Let us know what's going on in the chat, and if folks are putting stuff, even comments.
La?
For sure. There are bunches of questions.
Okay.
So I'll jump right in here, Wayne. One of them is, are there any, this is from Sean Perry. Are there any telltale signs that one might be experiencing the beginnings of MS?
Okay, so yes, thank you, Mr. Perry. So, as I mentioned, there is a syndrome, a subsyndrome called optic neuritis, which is a common heralding sign. It'll sometimes it shows up as a one-sided eye pain and decreased vision. Like someone will have problems with noting those bright orange outfits and shirts that you're wearing. It might be a bit muted, and that syndrome lasts like a couple of days. There's Lermite and Uthoff's phenomenon, where someone might note the pins and needles occur here and there, and they're worse in hot weather or like warm water. They might hyperextend their head and then get this shooting electric signal that runs through them. And these phenomena, they're not exclusive, and even the optic neuritis, it's not exclusive to MS, but these are common subsyndromes that occur with neuroimmunologic disorders that affect the CNS.
Wow.
Meaning CNS, meaning central nervous
I'm
system.
sorry,
So
central
the
nervous
brain,
system.
the brain
Yes,
of the spinal cord.
Yeah,
Yeah, exactly.
So we have wow, that's great information. We have another question from Egarvani. Hopefully that's properly pronounced. Are there any demographic clusters or geographic locations where there are more Black people with MS?
Great question.
Yeah.
Okay, yes, thank you. There have been studies that showed that there was a higher association with or incidence and prevalence of MS in communities further away from the equator. Again, that's associating that vitamin D deficiency.
Oh,
Makes sense.
wow.
And does MS, I read somewhere else that MS occurs in clusters. Like you might find several people
Oh
who,
yes, yeah. Sorry,
yeah.
yeah, of course. They're like farming communities. Maybe there might be an association with exposure to organophosphates, those chemicals that are used for as pesticides. Yeah.
Wow. Okay.
So we
So
also
to that,
go ahead.
I'm sorry.
I'm sorry, La.
No, you got it.
No. Oh, so couple things. I'm gonna run them together. What are plaques? Is MS inherited, and can you catch it from other people? And can you clean up plaques? That's from Yvonne.
Those are great questions. Okay, so the plaques are the scarring that occurs with that immune response, that degradation of the myelin, and they occur in the brain and the spinal cord. Unfortunately, we don't have a means to clearing them up. So once they happen, there's the damage to the nerves, and then the dysfunction that comes from that. But at the very least, we have the disease-modifying drugs that can decrease that inflammatory process, so decrease the formation of the plaques. But unfortunately, we cannot clear up the plaques.
And then there was a question about genetics in there, right?
Right.
The genetics, yes, there is. Again, there's not a specific genetic. There's a familial increase of a familial risk, but I can't necessarily say specific genes and genetic distribution that will result in multiple sclerosis.
All right. So they see it run in families, but they can't point to this is the gene right here.
Yeah, they can't anticipate that. Oh, yeah, exactly. Because these same, genetic oligoclonal glands or myelin basic protein that can occur. You could see that in other neuroimmunologic disorders. It's not specific to multiple sclerosis.
Yeah. Got it. Okay.
This is for you, Dr. O. Look, I'm quick to give somebody a nickname. Okay, so you're Dr.
No, that's
O
actually one of my nicknames. Yeah.
Oh, okay, good. You kind of touched on this in terms of having a neurologist and your PCP, as many people on your team as possible. But what kind of advice would you give to folks who are newly diagnosed in terms of advocating for themselves, because we are so often not seen and heard when we go to the hospital?
I'm glad that you asked that question. I would say it takes a lot. You have to be strong-willed, and that's why it helps to surround yourself with people that you trust and know, like family members, friends that will, unify with you to have that strong voice of advocacy. You just have to. It's easier said than done, but be relentless.
Sure.
Be
Mhm.
dogged. I had the benefit of seeing Miss Victoria Reese, who is the founder of one of the advocacy groups, We Are Ill, and she shared her own journey to diagnosis. And if she, listened to the doctor that thought, oh, it sounds like MS, but MS doesn't typically affect Black women. I don't think it is. But if she stopped right there, then it would have delayed her diagnosis, and who knows how what she would be living with now. And I love that she shared that. No, she was dogged. She said, she knows that what she's experiencing is real, and she did her own research.
Mm-hmm.
And she was relentless. She didn't stop with that one practitioner. She sought out, more information and a second opinion.
Right. So to your point about one of the things that we talked about off camera, the internet is a two-edged sword, right? We don't want to self-diagnose, but if we do have symptoms that aren't being explained, when we go to a doctor and it is raising questions, we should continue to talk to get a second opinion, right? Or even a
Yeah.
third opinion if
I agree.
you have that concern. Yeah.
And nobody
especially
knows our
if-
body like we know our body. We know when we're experiencing something different in our bodies. I feel like we get to really lean into what isn't normal for us.
Right.
Yes, I agree.
Right. So,
And whilst there are, I'm sorry.
no, go ahead.
No, go ahead.
Oh, what I wanted to say was that whilst there are, other possible conditions that might mimic multiple sclerosis,
Mhm.
it's another thing when someone has progression of symptoms. It's affecting
Right.
their livelihood, their ability to even do regular things, doing the laundry, doing my taxes. You should be able to do that without like mental and physical burden.
Right.
Mhm. Yeah.
Yeah.
Sure.
Yeah, well said. Well said.
So,
Because we don't want people to think that all the pins and needles that they have is because of MS, right?
Right.
But if things are
Right.
progressing and changing over time, then yes,
mhm.
yeah, definitely of concern.
couple things, and they're pouring in the comments. This is a hot topic. So we hear you talk about vitamin D, not getting enough vitamin D. Will taking vitamin D supplements help, or how much vitamin D do you have to take for it to make a difference outside of getting out and getting in the sun?
Well, I'm glad you asked that question. So, vitamin D deficiency is like one of the factors that might play into the development. So, what I do as a practitioner, I just make sure my patients are not deficient. I wouldn't say that getting a high dose would counteract or make the development less likely to happen. It's just that deficiency might, decrease the protection of the nervous system. So I don't want that to happen. I'll ensure that they're at least at a normal level, maybe slightly above what is the range of normal, but not, vitamin D is also kind of tricky. When it's too high, because it's a fat soluble vitamin, it stays within the system. That can also cause problems as well.
Mhm.
Yeah,
Everything
we
in my,
always
like you said earlier.
right, and we always encourage that, follow up with your PCP or whoever your doctor is to get your vitamin D level checked regularly, because you don't want
Yeah.
to self-medicate and overdo it too.
Exactly.
Right.
Yes. Thank you.
Which we as a people have a tendency to do. We hear about a supplement and we think Let
We'll
me
get
take as much of it as
As
A
much
possible.
whole
as
bottle
possible.
tomorrow. You'll go out and get a whole
Right.
bottle of vitamin D
Right. So
because you
caution.
felt pins and needles. Your leg went to sleep while
So
sitting
yeah,
down.
we
I'm
have
gonna
Right.
go. I might be getting MS. Let me go take this bottle of vitamin D. I just want
right.
to make sure
Yeah, don't
we're
do
not,
that.
we're
Right.
not
yeah.
doing that.
Don't do
Uh,
that.
so we have a question coming in from Nick Trix 84, and Nick Trix says, "How many studies around PTSD and MS have been done? They've been doing their own research, and I've noticed a trend in autoimmune and inflammatory chronic conditions and a
Yes.
history of trauma."
Like a
Mm.
link between PTSD and MS. Is that what
MS.
we're saying?
Yeah.
I
How many
couldn't give
studies
an
around
exact numbers. I'm just seeing more papers that are showing an
a
association
link?
with inflammation and neurodegenerative disorders.
Wow.
Yes.
Mhm.
Wow.
And it kind of makes sense because we're talking about stress, and when you have PTSD, you're reliving the stress over and over and over and over and over again. We know that stress leads to chronic inflammation, so it's not a surprise if that is eventually found to be a clear link.
Yes.
Wow. That was a good question. That was
Yeah,
a
it's a
really
great
good question.
question.
We have an informed audience. We have an
We
Yeah,
informed
do.
clearly.
audience.
Yeah.
We
Doc-
have
oh, okay.
we
Go ahead.
we
Wayne.
have a comment from Stella Lakeisha. Stella Lakeisha says, "I'm glad I followed natural route. I've been through rough experience and found success with natural remedies for natural remedies to UTI, MS, and fibromyalgia." All right. Check another doctor's page. I won't get that doctor's page, but check the internet. And she says she's been uh, through a natural route. Do we have any natural cures other than vitamin D, which occurs naturally?
Well, what I like to highlight that it's good to utilize multiple modalities to
Sure.
healthy living. It's good to use the medications that studies have shown that will work on the immune system whilst eating a diet that would decrease inflammation, exercise that we know decreases inflammation as well. So yeah, there's certain supplements outside of vitamin D, like alpha lipoic acid, that is associated with decreased inflammation and helps with the nervous system. B12 is also great. It's a cofactor in many chemical processes that protect the nervous system and the health of the spinal cord specifically, which unfortunately is a target with MS. But I can't say that, oh, it's either pharmacotherapy versus the natural life. Why not use everything that we have at our disposal?
Mhm.
Right. Great point. Great point. Can I just throw in a question in terms of symptom control, acupuncture as
Oh,
another potential modality?
Yeah.
yes.
Mhm.
Acupuncture, electric stimulation with transmagnetic stimulation or transcutaneous stimulation are helpful for pain management. And it decreases your likelihood of having, side effects from medications, and could possibly help with what we call neuromodulation, which is the healing process of the nervous system.
That
Mhm.
electrostimulation is one of my favorite kinds of treatments at the
Right.
chiro's office. I love it.
Right. But I love
Dr.
that
O,
putting all those
all
different things
together.
together. Yeah.
Yeah, yeah.
Mhm.
So Dr. O, you heard us do our weekly debunk. We debunk myths around here. Are there any
Yeah.
myths that you've heard about MS that you can sort of debunk for us?
One, that it doesn't affect people of color. It does, as we and I again appreciate you giving me the opportunity to highlight that along with my colleagues that I mentioned earlier. That unfortunately there's a high incidence, and if this helps anyone who might have been experiencing symptoms like this to start a conversation, I'm glad for it. Um, What other things can I think of with MS? That there's one, the biggest one that I've come to know as a more advanced healthcare practitioner, there's no one picture of MS. There's some subtle signs. People can have very subtle signs, and we get imaging for whatever reason. See, oh goodness, like the pins and needles, just that they were experiencing, it was actually likely associated with their multiple sclerosis or a headache, even, which is
Oh,
it's considered a very common syndrome. It can be mild, and that could be associated with someone's multiple sclerosis.
okay.
Wow. So we got just time for a few more questions, but one is asked by Rhoda Lawrence, our West Coast producer. She says, what's the typical lifespan after MS diagnosis? Is there a typical lifespan?
What I'd like to focus on is how the livelihood of, I feel, all persons that are diagnosed today compared to yesteryear have improved tremendously.
Oh, wow.
Whenever I talk to the medical students about it, I talk about, I don't know if anyone was a fan of the Mickey Mouse Club, but Annette Funicello,
Right.
she was
Oh, yeah.
diagnosed decades ago, and she lived well into her late 70s, maybe I think even 80s.
80s.
So yeah, yeah. So many decades ago, that wasn't a possibility, but because of newer medications and the realization that we need to utilize different therapies, physical therapy, occupational therapy, and there's advancements with that, acupuncture, naturopathic therapies, increasing education so people have earlier diagnosis and started pharmacotherapy earlier, their prognosis is a lot better.
Hey, Doc, I'm going to put up can you name some of the organizations, support groups, resources, and remind people of them, Black people living with MS?
Okay, great. So again, I want to highlight We Are Ill, which was founded by Victoria Reese, who's a fellow alumna of Howard University.
All
And I
right.
had the,
HU.
yes, HU. I had the opportunity to see her and her colleague, Dr. Mitzi Joy Williams, who's another founder of another advocacy organization, tip off their education tour around the country. And then, of course, you have the the National Multiple Sclerosis Society, or the MS Foundation, Can Do MS, the Multiple Sclerosis Association of America, amongst many organizations that help people get access to free MRIs, access to neuroimmunologists, so neurologists that are specialized in MS, and then connect you with other persons who have the disorder so that you can learn about how it is from other persons that were diagnosed, like how are they doing, their journey, empower you from knowing that you too can have this diagnosis and have a bright and optimized livelihood.
Well, unfortunately, we have to end on that note. I love that you got the word empowered in there, because that's what we are all about here. It's my Be Health Empowered family that tunes in every week. And that is why we are here, to get empowered when it comes to our health. And certainly if we have an MS diagnosis or there's somebody that we love, I think we've had a tremendous show today. Thank you so much, Dr. Oyawusi, Dr. O, for being here and giving us all that great information. Thanks, my wonderful co-host. Love you. And shout out to Wayne Bruce for scrolling those resources across the screen. Thanks to my Be Health Empowered family for the great questions. And until we see you next time, be wise, be well, and be health empowered.